It's Great Day Houston. From food, fun, health, family, in other words, your life. It's your morning wake-up call to everything Houston.
Welcome back to Medical Monday. Our next guest says she struggled for 23 years with depression, fibromyalgia, and migraines before finally getting the help she truly needed. Instead of masking the symptoms with medications, our next doctor got to the root of her problems by addressing the underlying cause. So here to tell us more, please welcome Dr. Stephen Hotze with the Hotze Health and Wellness Center, along with his patient, Phoebe Wagner. Hi. Hello. Okay, you know this is my soapbox, right?
Yeah,
okay,
absolutely.
Because it happened with me. Phoebe, I was going to say, tell me about your life, but actually it was no kind of life for about 20 years.
Right. I had my son when I was 20, and shortly after that, I began having migraines. And by the time I was 27 years old, I had depression, anxiety, panic attacks. I had frequent urinary tract infections, and also a lot of yeast problems, which I had read the yeast connection, and I felt like I was really having yeast complications.
Your body was just kind of revolting,
just everything,
wasn't it? Yeah.
Right. And I went to many doctors, even thinking that I had yeast problems and saying that I had yeast problems, and no one helped me. Not only did they
tell you?
Not only did they not help me, they put me on antibiotic after antibiotic.
Which is not good for you,
for
obviously.
Urinary tract infections and sinus infections. Yeah. I was on antidepressants for fibromyalgia and for depression and for panic attacks. I also was on an antispasmodic for irritable bowel syndrome. And just medication upon medication,
and weren't helping.
And nothing was helping.
Yeah. And Dr. Hotze, when you hear a patient come in your door with all these things, you kind of go, I know what part of the body is attacking you, really. I know what the issue is for the most part. You do the test and you figure it out. So what was happening in her body?
Well, this was clear. This all started after she had her second baby. Mm-hmm. And, you know, then she's labeled with all these she begins to have all these health problems that occur, which obviously have to do with hormonal imbalance and decline, which can happen very commonly after childbirth. Many women, I don't know how many women in the audience felt like their metabolism went down after you had your first baby. Anybody ever experienced that?
Yeah. So you're still blaming that baby for the but yeah, and your mood difference. How many of you had the mood change? You just didn't feel like yourself, right? And so people kept telling you, oh, you just had a baby, so deal with it. But you're saying we don't have to just deal with it.
You don't. And this is classically what happens. The hormones become imbalanced, the female sex hormones. And that adversely affects the body's ability to utilize natural thyroid hormones. So they don't get enough thyroid in their cells. You may have it in your blood. So the doctor says you got thyroid in your blood. But all the symptoms indicate you don't have enough thyroid in your cells.
Right. And without, like, our progesterone, estrogen, the thyroid, our immune system's impacted, our mood is impacted.
So when you don't have enough thyroid, then your immune system falters because you don't have enough energy to produce it. You can't think clearly. You have all these mood changes.
Metabolism.
And the doctors throw you on one antidepressant after another, making you feel like it's all in your head.
Right.
Yeah. And I want to talk about, too, when she said fibromyalgia, because I know you have an issue with this. You actually call it a kind of a made-up disease. Right. Not that the people aren't in pain.
Well, fibromyalgia, you go to the doctor and say, I've got muscle aches and pains, I haven't been able to sleep, and I'm fatigued all the time. They do a battery of tests and say you have fibromyalgia, and you go, what is that? Well, that's joint muscle aches and pains. You go, that's what I told you I had.
Yeah. What's the cause?
But they give you the diagnosis in Latin. So fibromyalgia, which means joint muscle aches and pains, and then they put you on some drug like Lyrica or some antidepressant and say, well, this is going to treat it. That's not the cause of it. The cause of fibromyalgia 99.99% of the time is low thyroid. And instead of using synthetic thyroid, we use the natural desiccated thyroid.
That your body recognizes.
Absolutely. And it works. And we treat. And so when Phoebe came in 2005, so it's been 12 years on the 6th of May, tell us what happened. We put you on the thyroid, got you on natural progesterone, balanced out your hormones, and
I felt great after that. Thank you.
I mean, at the same time that you were so happy right now to have your life back, it kind of makes you mad that you had to struggle for it for so long.
Well, it's amazing, and I went to probably 10 to 15 different doctors, and not one of them ever suggested I may have a thyroid.
Something as simple as that.
Right, not ever. And
Dr. Hotze, why is that? I think it's just that we're so at a loss for why is that?
One, they're not trained to think about low thyroid problems. When they do, they base it strictly on blood tests, which I think is incorrect. And then if they find it on blood tests, which is rare as hen's teeth, they put them on a synthetic thyroid that doesn't improve their symptoms, and then invariably they go, well, your blood's normal, so we got to put you on antidepressants. And antidepressants have been proven that they are no more effective than a sugar pill. In the latest statistical studies, antidepressants have no positive effect more than a sugar pill, and they have severe side effects and withdrawal effects.
Yeah,
they're very dangerous drugs.
The blood test is that they have this kind of set range. Well, if this is not my range, then what, you know, then how are we figuring out where I should be?
Long and the short of it is they take the average of the last 1,000 tests the lab companies do, and then they have 2 statistical standard deviations away from that, which incorporates 95% of the population. If you fall in this wide range, you're considered within the range, and they won't treat you, which is crazy.
Because you listen to your symptoms tell you that there is a problem. Obviously, there's a problem.
And you give them a therapeutic trial. Why give them an antidepressant, which is a chemical that is modeled after cocaine? Did you know cocaine? The antidepressants are modeled after the same thing that cocaine does. They're neurotransmitter reuptake inhibitors. They all modeled after cocaine. Very addictive drugs, very dangerous drugs. Why would you give somebody that when you can give them natural occurring thyroid and a natural female hormone?
Not to cover up the problem.
Right.
All right. Now, just tell me, did you gain weight after having your baby?
I did, but I taught dance for over 20 years.
So I was going to say stand up, because I'm getting my hormones rebalanced if this is what... You might need to take another look at my hormones, Dr. Hotze, if I can get that right there.
But, you know, I didn't have a weight problem, but when I went to Dr. Hotze, I think I was a little bit overweight, but I lost 10 pounds just from being on the program, not from any...
Metabolism could stabilize, and you felt like getting up and getting around, too.
And that was 7 years ago, and I have not gained 1 pound back.
Look at you. All right. Dr. Hotze brought copies of his book. It's called Hormones, Health, and Happiness for everyone in the audience, because there's a lot to hormones, but he makes it very easy in this book to understand. He also hosts a local radio program, Health and Wellness Solutions, every Monday through Thursday from 12 noon to 1 p.m. on 700 a.m. You can also listen live online at hotzehwc.com. For more information on Get Your Life Back and Your Body Back Too in Balance, call the Hotze Health and Wellness Center at 281-698-8698, 281-698-8698, or log on to hotzehwc.com if you are sick and tired of being sick and tired. All right. Thank you very much, Dr. Hotze. Up next, for years, Sarita used